As the number of COVID-19 cases continue to rise in the Democratic Republic of Congo, health experts are warning that thousands of children are at risk of missing out on life-saving vaccines, although children are at a relatively low risk of severe disease and death from the virus. It's disrupting immunization services in many of the world's poorest countries.
In 2019, the Democratic Republic of Congo experienced one of the world's worst measles epidemic, with more than 5,300 reported deaths. The deadly measles outbreak was a result of low vaccination coverage, as well as malnutrition in some communities, a weak and overburdened public health system, insecurity, and difficult access to healthcare, especially in rural areas. Measles response efforts have been largely hampered by competing priorities, including the Ebola response, and now UNICEF warns that thousands of children may miss out on receiving life-saving vaccines due to COVID-19. Additional prevailing challenges include poor infrastructure, shortages of vaccines, and in some instances, a lack of trust in health teams.
As you know, there are lots of refugees from Angola who come to Chikapa. This transfer of population means that even when the situation is under control, suddenly, because of this transfer of population, there is a fluctuation regarding the measles cases.
The United Nations Children's Agency and its partners are conducting measles vaccination campaigns in the hardest hit areas, as well as providing medical supplies for treatment. So far, the agency has distributed 1,317 medical measles kits containing antibiotics, rehydration salts, vitamin A and other medicines to allow affected health zones in the country. The government will also continue conducting vaccination campaigns across the country as the battle against COVID-19 continues.
We educate the population of the advantage of the vaccination. A vaccinated child is a protected child. Even if the epidemic appears suddenly, he will always be protected.
In North Kivu province, where over 3,000 cases of measles were reported since January, UNICEF is boosting vaccine supplies and protective equipment to continue immunization activities. In Ituri, a vaccination campaign is underway to vaccinate more than 53,000 children between 6 and 59 months against measles. Measles is a highly contagious disease, and unvaccinated young children are at great risk of contracting measles and suffering complications, including death.